Have you ever wondered if testicular cancer is something you should be concerned about in old age? While it is more common in younger men, older adults are not immune, and catching it early can make all the difference. In today's video, we'll explore how to prevent and detect testicular cancer as you age. Before we begin, make sure to subscribe to this channel for free by clicking the red button below so you never miss an important health update. And let us know in the comments, what country are you watching from? Testicular cancer is often thought of as a young man's disease, but that doesn't mean older adults are completely safe. While it's true that the majority of cases occur in men between the ages of 15 and 40, testicular cancer can still develop later in life, particularly in those who have had risk factors such as undescended testicles, a family history of the disease, or prior testicular abnormalities. The key to staying ahead of any potential health concerns is awareness and early detection. So what exactly is testicular cancer? This type of cancer originates in the testicles, which are responsible for producing sperm and testosterone. Unlike other forms of cancer that may spread slowly, testicular cancer is known for its rapid growth. The good news is that it is also one of the most treatable cancers, with a very high survival rate when detected early. That's why it's so important for men, even in their senior years, to remain vigilant about changes in their bodies. Many older men assume that because they are past their reproductive years, they don't need to pay attention to their testicular health. However, this assumption can be dangerous. In some cases, testicular cancer can develop without causing noticeable pain, making it easy to ignore until the disease has progressed. Symptoms can be subtle, including a slight enlargement of one testicle, a feeling of heaviness in the scrotum, or a dull ache in the lower abdomen or groin. These warning signs should never be ignored, no matter your age. There are also cases where testicular cancer is discovered incidentally, meaning it is found during routine medical examinations or imaging tests for unrelated health concerns. This highlights the importance of regular checkups, especially for men over 70 who might already be seeing doctors for other conditions. An annual physical exam that includes a testicular check can be a crucial step in early detection. The risk of developing testicular cancer in old age is low, but it is not zero. Staying informed about the symptoms, performing regular self-exams, and getting routine medical checkups can all contribute to early detection and successful treatment. In the next section, we will explore the biggest risk factors for developing testicular cancer later in life and what you can do to reduce your risk. While testicular cancer is less common in men over 70, it is still a possibility, and certain factors can increase the likelihood of developing this disease. Understanding these risk factors can help seniors take the necessary steps to stay vigilant about their health and catch any warning signs early. One of the most significant risk factors is a history of an undescended testicle, a condition known as cryptorchidism. When a baby boy is born, his testicles should descend from the abdomen into the scrotum. However, in some cases, one or both testicles fail to move into the proper position. Even if this issue was corrected through surgery during childhood, the risk of developing testicular cancer remains higher throughout life. Another major risk factor is a family history of testicular cancer. If a father or brother has had this disease, the chances of developing it increase significantly. Genetics play a key role in determining cancer risk, and while having a family history does not guarantee that you will get the disease, it is something that should encourage regular self-examinations and discussions with a doctor. Previous testicular cancer is also a risk factor. If a man has had cancer in one testicle, he has an increased risk of developing it in the other. This makes long-term monitoring essential, even decades after initial treatment. Many men who have survived testicular cancer assume they are in the clear, but ongoing vigilance is necessary. Age itself is a consideration, even though testicular cancer is more commonly diagnosed in younger men. The risk never completely disappears. As the body ages, changes in cell growth and function can contribute to the development of abnormal cells, including cancerous ones. Though rare, testicular cancer can occur in older men, and those with a weakened immune system may be at greater risk. Certain medical conditions, such as HIV or other immune system disorders, may also contribute to an increased likelihood of testicular cancer. A weakened immune system can make it more difficult for the body to fight off abnormal cell growth, leading to an increased risk of many cancers, including this one. Exposure to chemicals or environmental toxins is another factor that should not be ignored. Long-term exposure to certain industrial chemicals, pesticides, or radiation may increase the likelihood of developing testicular cancer. Men who have worked in certain industries for many years may have a slightly higher risk and should be extra cautious about monitoring their health. Finally, lifestyle choices such as smoking, excessive alcohol consumption, and an unhealthy diet may not directly cause testicular cancer, but they can weaken the body's natural defenses. A strong immune system plays a vital role in detecting and eliminating abnormal cells before they become a serious problem. By understanding these risk factors, older men can be more proactive about their health. In the next section, we will discuss the symptoms of testicular cancer and what to look out for so that any warning signs can be addressed early. Recognizing the symptoms of testicular cancer early can make all the difference in successful treatment. Many men, especially as they age, dismiss mild discomfort or changes in their bodies as part of the natural aging process. However, certain warning signs should never be ignored. Knowing what to look for can help detect the disease at an early stage when it is most treatable. One of the most common symptoms of testicular cancer is a lump or swelling in one of the testicles. This lump is often painless, which is why it is easy to overlook. Many men do not regularly check themselves, assuming that if there were a serious issue, they would feel pain. However, testicular cancer often develops without causing discomfort at first. The lump may feel firm and can be as small as a pea or as large as a marble. If you notice any unusual growth in the testicle, even if it is painless, it is essential to see a doctor immediately. A noticeable change in the size or shape of a testicle is another important warning sign. Some men experience swelling in one testicle, making it larger than the other. In some cases, the affected testicle may shrink rather than grow. Any significant change in size, firmness, or shape should be taken seriously and checked by a medical professional. Another symptom is a feeling of heaviness or aching in the lower abdomen or scrotum. This discomfort is often mild and persistent, making it easy to dismiss. Some men may experience a dull ache in the lower belly, groin, or back. This aching sensation is caused by the tumor pressing on nearby nerves or tissues. Since older men are more prone to general aches and pains, it can be difficult to distinguish this from normal discomfort. However, if the ache is persistent or accompanied by other symptoms, it should be investigated further. A buildup of fluid in the scrotum, known as hydrocele, is another symptom that can indicate testicular cancer. Some men notice sudden swelling or a feeling of increased weight in the scrotum without knowing why. This fluid buildup may come and go, but any unexplained swelling in the scrotum should always be checked. In more advanced cases, testicular cancer can spread to other parts of the body. If this happens, additional symptoms may appear. If the cancer spreads to the lymph nodes in the abdomen, it may cause persistent lower back pain. If it spreads to the lungs, symptoms may include shortness of breath, chest pain, or a cough that does not go away. If it reaches the bones, it may cause unexplained bone pain. One often overlooked symptom of testicular cancer is unexplained fatigue. Cancer places a strain on the body's energy levels, and feeling unusually tired or weak for no clear reason can sometimes be an early sign of the disease. If you notice persistent fatigue that does not improve with rest, it is worth mentioning to your doctor. Another rare symptom that can sometimes appear is breast tenderness or enlargement. This happens because testicular tumors can produce hormones that affect the body's balance. If you notice any changes in your chest area, such as swelling or tenderness, it could be a sign of an underlying hormonal issue related to testicular cancer. Many men assume that testicular cancer is something that only affects younger men. However, it can develop at any age, and the symptoms are often subtle. Regular self-examinations and awareness of these warning signs are crucial for early detection. If you experience any of these symptoms, do not wait, seek medical advice as soon as possible. In the next section, we will discuss how older men can perform a simple self-examination at home to check for early signs of testicular cancer. Regular self-examinations are one of the most effective ways to detect testicular cancer early. Many men, especially as they age, do not routinely check their testicles for changes, assuming that if something were wrong, they would feel pain or discomfort. However, Testicular cancer often develops silently, with no immediate signs of pain. That's why knowing how to perform a simple self-examination at home is essential. The best time to check for testicular abnormalities is during or after a warm shower or bath. The warmth relaxes the scrotum, making it easier to feel any changes in the testicles. Choose a quiet and comfortable place where you can perform the exam without rushing. This simple routine should only take a few minutes but could make a life-saving difference. Start by standing in front of a mirror and visually inspecting the scrotum. Look for any swelling, changes in shape, or areas that appear different from usual. The skin of the scrotum naturally varies in texture, but any noticeable irregularities or swelling should be noted. Next, gently hold one testicle between your thumb and fingers and roll it slowly. You are feeling for any lumps, hard spots, or unusual firmness. A normal testicle should feel smooth and slightly firm but without any distinct lumps or areas of hardness. Repeat this process on the other side. It is important to know that each testicle has a small, soft structure called the epididymis, located at the back. This is a normal part of the anatomy and should not be mistaken for an abnormal lump. Over time, you will become familiar with how your testicles typically feel, making it easier to detect any changes. If you notice any lump, swelling, or areas of unusual firmness, it is essential to see a doctor as soon as possible. Not all lumps are cancerous, but only a medical professional can determine if further testing is needed. The earlier an issue is detected, the better the chances of successful treatment. Another key aspect of self-examinations is consistency. Checking once and forgetting about it is not enough. Older men should aim to perform a self-examination at least once a month. Establishing this habit ensures that any potential problems are detected early. Aside from lumps, pay attention to any changes in testicular size. If one testicle becomes significantly larger or smaller over time, this could be a sign of an underlying issue. Similarly, if you notice a sensation of heaviness in the scrotum or an unexplained ache in the lower abdomen, groin, or back, do not ignore it. These symptoms could indicate testicular cancer or another medical condition requiring attention. Men with a history of undescended testicles or previous testicular conditions should be especially vigilant. Those who have had testicular trauma or a family history of testicular cancer should also take self-examinations seriously. While testicular cancer is less common in older men, it can still occur, and early detection is the key to effective treatment. It is also worth discussing self-examinations with a doctor during routine medical checkups. Some men may feel unsure about what is normal and what is not. A doctor can provide guidance on what to look for and when to seek medical advice. Additionally, if any concerning changes are found, a doctor may recommend further tests such as an ultrasound or blood work to rule out serious conditions. Many men hesitate to talk about testicular health due to embarrassment or discomfort. However, open discussions about self-examinations can help normalize the practice and encourage others to be proactive about their health. Performing regular self-checks is a simple yet powerful tool in catching testicular cancer early. In the next section, we will discuss what to do if you suspect something is wrong and the medical steps involved in diagnosing and treating testicular cancer. If you or someone you know discovers a lump, swelling, or any unusual changes in the testicles, the most important step is to seek medical attention immediately. Many men hesitate, either due to fear or embarrassment, but delaying a doctor's visit can make a significant difference in treatment outcomes. The good news is that testicular cancer, when detected early, has a very high survival rate. If something unusual is noticed, a doctor will typically begin with a physical examination to check for lumps, swelling, or irregularities in the testicles and surrounding areas. If there is concern, they may order an ultrasound scan, which provides a detailed image of the testicle's structure. An ultrasound can help determine whether a lump is solid, which may indicate cancer, or filled with fluid, which is likely benign, such as a cyst. If the doctor suspects testicular cancer, they may also order blood tests to check for tumor markers, substances that some testicular cancers release into the bloodstream. These markers include alpha-fetoprotein, beta-human chorionic gonadotropin, and lactate dehydrogenase. While not all cases of testicular cancer show elevated markers, they can provide valuable information about the presence and type of cancer. In some cases, if cancer is suspected, the affected testicle may need to be surgically removed for further examination. This procedure, called an orchiectomy, is both a diagnostic and treatment step, as removing the tumor prevents the cancer from spreading. Testicular cancer is highly treatable, and even in advanced cases, survival rates remain high. The exact treatment plan depends on the stage of cancer and whether it has spread. The most common first step in treating testicular cancer is surgically removing the affected testicle. This procedure is straightforward, and most men can continue living a normal, healthy life with one testicle. If the cancer is caught early, surgery alone may be enough. If the cancer has spread to nearby lymph nodes, doctors may recommend radiation therapy. This treatment uses targeted radiation to destroy cancer cells. It is more commonly used for seminomas, a type of testicular cancer that responds well to radiation. If the cancer has spread beyond the testicles, chemotherapy may be required. This involves using powerful medications to destroy cancer cells throughout the body. While chemotherapy can have side effects, it is highly effective in curing testicular cancer, even in advanced stages. In some early-stage cases, after the testicle is removed, doctors may recommend regular monitoring instead of immediate additional treatment. This involves periodic checkups, blood tests, and imaging scans to ensure that the cancer does not return. Most men recover fully from testicular cancer and go on to live normal, healthy lives. The removal of one testicle does not affect sexual function, testosterone levels, or fertility in most cases. However, for men who require chemotherapy or radiation, there may be a temporary or permanent impact on fertility. Those concerned about future fertility can discuss sperm banking with their doctor before starting treatment. For men who feel self-conscious about having only one testicle, testicular implants are an option. These are artificial testicles that can be surgically placed to restore a natural appearance. While there is no guaranteed way to prevent testicular cancer, adopting certain habits can help reduce risk and promote overall health. Regular self-examinations are one of the best ways to detect cancer early. The sooner it is found, the easier it is to treat. A healthy diet rich in fruits, vegetables, and lean proteins supports immune function and overall well-being. Avoiding excessive alcohol consumption and quitting smoking can also lower cancer risk. If there is a family history of testicular cancer or a history of undescended testicles, discussing personal risk factors with a doctor can be beneficial. Some studies suggest that prolonged exposure to certain environmental toxins may contribute to testicular cancer risk, so minimizing exposure to harmful pesticides, heavy metals, and endocrine-disrupting chemicals may be helpful. Understanding testicular cancer and taking proactive steps can save lives. It is a highly treatable disease, and survival rates are excellent when caught early. By performing regular self-examinations, maintaining a healthy lifestyle, and seeking medical attention if anything seems unusual, you can protect yourself and encourage others to do the same. Thank you for watching this important discussion on testicular cancer. If you found this video helpful, remember to subscribe to our channel for more health advice tailored for older adults. Also, let us know in the comments, have you ever done a self-examination before? Sharing your thoughts might encourage someone else to take action. Stay healthy, stay informed, and we'll see you in the next video.